The miracle of life, embracing the journey of pregnancy. Pregnancy is an incredible journey of transformation. It's a time of profound physical and emotional changes. Understanding the stages of pregnancy is essential. This essay will guide you from conception to birth. Pregnancy is divided into 3 trimesters. The first trimester lays the foundation. The second trimester brings noticeable changes. The third trimester is preparation for birth. The mother's body undergoes remarkable adaptations. Understanding these changes is empowering. It allows informed decisions about health and birth. This knowledge fosters a deeper connection with your baby. From conception, a tiny cluster of cells transforms. The miracle of life unfolds within the womb. Delve into pregnancy, childbirth, and early infant care. The first trimester, weeks 1 to 12, is a period of rapid development for the baby. The fertilized egg or zygote travels down the fallopian tube and implants in the uterus. Cells rapidly divide, forming the placenta, umbilical cord, and amniotic sac. By week 4, the baby's heart begins to beat. The neural tube starts to form, developing into the brain and spinal cord. The second trimester, from weeks 13 to 26, is often considered the honeymoon phase of pregnancy. Many women experience a surge in energy and a decrease in early pregnancy symptoms. The baby continues to grow rapidly, and the mother will start to feel those first magical flutters of movement known as quickening. By week 16, the baby can hear sounds from the outside world, and their eyesight begins to develop. They start to develop sleep-wake cycles and may even suck their thumb.
The mother's belly becomes more noticeable, and she may experience some new physical changes, such as a darkening of the areolas, a line down the abdomen called linea nigra, and stretch marks. During the second trimester, it's essential to continue with a healthy diet, focusing on nutrient-rich foods like fruits, vegetables, lean protein, and whole grains. Staying hydrated is also crucial, as is getting regular exercise. Prenatal appointments become more frequent, allowing the healthcare provider to monitor the baby's growth and the mother's health.
Section 4. The third trimester. Preparing for the grand arrival. The third trimester, spanning weeks 27 to 40, is a time of significant growth for the baby and preparation for birth for both mother and child. The baby's organs mature, they gain weight rapidly, and their movements become stronger. The mother's body undergoes final preparations for labor and delivery. By week 36, the baby is considered full-term, meaning their organs are fully developed and they are ready for life outside the womb. The mother may experience increased pressure on her bladder, shortness of breath, and difficulty sleeping as the baby grows larger.
During this trimester, it's essential to rest as much as possible, stay hydrated, and continue with a healthy diet. Prenatal appointments become even more frequent to monitor the baby's position and the mother's health. It's also a good time to finalize birth plans, prepare the nursery, and pack the hospital bag.
Section 5. The big day: labor, delivery, and welcoming your baby. Labor and delivery mark the culmination of the pregnancy journey, a time of intense physical and emotional experiences as the baby makes their way into the world. Labor typically begins with contractions, which gradually become stronger and more regular. The cervix, the opening of the uterus, softens, thins, and dilates to allow the baby to pass through. The first stage of labor is the longest, lasting from a few hours to over a day. The second stage involves pushing and the actual birth of the baby. The third stage is the delivery of the placenta.
There are different types of delivery, including vaginal delivery and cesarean section or C-section. Vaginal delivery is the most common and involves the baby being born through the birth canal. A C-section is a surgical procedure in which the baby is delivered through an incision made in the abdomen and uterus. The type of delivery will depend on various factors, including the mother's health, the baby's position, and any complications that arise.
Section 6. Nourishing yourself, post-delivery diet and care. After delivery, the mother's body begins the process of healing and recovery. A nutritious diet is essential during this time to support healing, replenish nutrient stores, and provide energy. Focus on consuming plenty of fruits, vegetables, whole grains, lean protein and healthy fats.
For mothers who have had a C-section, it's especially important to eat foods that promote healing and prevent constipation, which can be a common side effect of surgery. Include fiber-rich foods, such as fruits, vegetables, and whole grains, and drink plenty of fluids. In addition to diet, prioritize rest and allow your body to heal. Gentle exercise, such as walking, can aid in recovery and boost energy levels. Don't hesitate to ask for help from loved ones with household chores and baby care, allowing you to focus on your recovery.
Section 7. Caring for your newborn, a guide to the first month. The first month of a baby's life is a time of significant adjustment for both the newborn and the parents. Newborns are completely dependent on their caregivers for all of their needs, including feeding, sleeping, and hygiene. Feeding is one of the most important aspects of newborn care. Breast milk is the ideal food for babies, providing all of the nutrients they need to grow and thrive. If breastfeeding is not possible or preferred, formula feeding is a healthy alternative.
Newborns sleep for most of the day and night, waking frequently for feedings. It's important to establish a safe sleep environment for the baby, placing them on their back to sleep on a firm surface without any loose bedding or toys. Newborns also require frequent diaper changes and gentle bathing. Regular checkups with the pediatrician are crucial during the first month to monitor the baby's growth, development, and overall health.